An Indian senior citizen's experience in the United States is now going viral, raising fresh questions about America's biggest challenge, its healthcare system. Imagine buying a medicine that costs around 2,500 rupees in India, and now imagine paying nearly 42,000 Indian rupees for that same medicine in the US. And that is exactly what one Indian visitor claims happened while staying in Seattle. Adhir Sinha, who has been living in the United States with his wife for the past 2 months, shared his extremely weird experience on social media and using the platform X for it. According to the post, his wife was recovering from a respiratory illness using medicines prescribed in India. But when their supply ran out, they had to seek treatment in the United States. And Sinha said that the process itself was not at all simple. Firstly, they had to book an appointment with the general physician before they could even meet a lung specialist. Even that appointment was available only after 1 week. And then it took around 10 minutes for the video consultation. Doctor prescribed medicines, but according to Sinha, it took another 5 days before finally received them. So many lags. Well, the biggest surprise came when he looked at the medicine bill. Sinha said that the medicines were manufactured by Indian pharmaceutical company Cipla and were clearly labeled made in India. And despite having health insurance that covered half of the cost, he said that they still paid around 21,000 Indian rupees out of the pocket. That means the full price of the medicine was around 42,000 Indian rupees, almost 70 times higher than the medicine that it costed in India. The expenses did not end there. About a week later, Sinha said that he also received doctor's consultation bill of around 283 USD, or which is roughly around 23,000 Indian rupees. And based on his experience, the advantages of the retired people, he said he praised that Indian healthcare is far better than India. It has quick access to the medicines, low cost mobile data, digital payments through UPI, high domestic help, and strong community approach. Now, his post quickly attracted thousands of reactions online. Some users agreed to it, that saying that India's affordable healthcare and the lower daily living costs are the major strengths for it. Others pointed out that countries like United States still offer a better infrastructure, clearer surroundings, and long life, basically a longer average life expectancy. It is important to note that the healthcare cost in the United States can vary depending on the insurance plans, hospitals, pharmacies, and the type of medications. Now, individual experience may reflect a very different patient situation, by the way. Still, Sinha's story has once again highlighted the sharp difference between the healthcare cost in India and in the United States. Well, for many Indians planning to study, work, and retire abroad, it is also a reminder that understanding healthcare insurance and medical expenses is just as important as planning the travel or maybe employment, because sometimes the biggest cultural shock is not just the language or lifestyle, it is the hospital bill.